Okay, so this is Dr. Evan O'Brien. He is an orthopedic spine surgeon, also a friend of mine who ended up having a knee scope done elsewhere. He has a section of bone-on-bone arthritis in his knee. After the knee scope, he actually ended up getting worse and worse. He's super active, ends up doing CrossFit and box jumps and all these things, and was just not able to do the things he's used to. So we ended up doing stem cells to the knee. And so Evan, why don't you tell us your story here?
It kind of crept up with me. I had this arthroscopy. I thought I had a meniscus tear. 3 months later, I was worse. I was limping. Turns out I had lost all the cartilage on the inside of my knee. So I had medial compartment arthritis, bone on bone. I investigated things I could do at this point besides total joint replacement. And one of the things that came up was PRP. Another thing that came up was intraosseous injection of bone marrow. And I actually went to a conference and heard them talking about this, that they actually had patients who needed total knee replacements who had this instead, and they were able to function quite well and never actually got the total knee replacement. So based on that, I decided I want to get this. I knew that Mark, Dr. Ayzenberg, was doing this type of bone marrow concentration and then injected it into the bone underneath the cartilage defect. So in my case, that was into the tibial plateau, just under the cartilage defect, and into the femoral side under the cartilage, above the cartilage defect. And he was able to do it actually on an outpatient basis. It was a little hard, but he took my bone marrow out and concentrated it and then injected it back into my knee, took the bone marrow out of my iliac crest. It wasn't too bad at all. And he said it might take 4 or 5 months, and I really didn't feel much improvement until about 4 or 5 months. And then suddenly I was not limping anymore. I was able to walk okay. And I've been doing quite well since then. And I actually returned to CrossFit. It's not perfect, but it's much better than it was, and I'm much more functional than I was before. And I definitely would recommend somebody trying an intraosseous bone marrow injection prior to total knee replacement if it's indicated.